Hi, I'm Dr. Jeffrey Miller, owner and founder of Miller Vein. I know, it's original. Today we're discussing the hidden dangers of delaying varicose vein treatment. I've got some notes in front of me that I'm going to be referring to, and I'm going to give you some really cool information. So varicose veins are more than just a cosmetic condition. It's unfortunate that many people think varicose veins are just cosmetic. Varicose veins significantly affect quality of life. People suffer from pain, swelling, aching, throbbing, heaviness, fatigue, night cramps, restless legs, to name a few. So, there was a recent study at Norwalk and Norwich University that shed some light on the risks associated with delaying varicose vein procedures. This was done during COVID, in fact, and that's how we got this data. So let's start with, what are varicose veins? Varicose veins are those swollen, twisted, bulging veins at the surface of the skin. They usually occur in the legs. As I already mentioned, they cause all kinds of symptoms: pain, swelling, aching, throbbing, heaviness, fatigue, night cramps, restless legs. I've said this a few times before. So these symptoms can worsen over time. What most patients tell me actually is that if they have the opportunity to sit down and elevate their legs, that'll make their legs feel better. Most patients also tell me their symptoms get worse as the day goes on. So if they're standing for prolonged periods of time or sitting for prolonged periods of time, that's when their symptoms get worse. All right, so now let's get into this article. During the height of COVID, many elective procedures, including varicose vein treatments, were postponed to prioritize other urgent medical needs. And the thought was also to decrease the risk of virus transmission. Many patients waited a very long time to get their varicose veins treated. So here's what we learned over that time. In this study, which included 275 patients that were waiting for varicose vein treatment, they waited for over a year. And the results of this study were actually somewhat concerning. So major harm occurred in almost 7% of patients. So they got things like phlebitis, inflammation of the vein, bleeding, and ulceration. Minor harm occurred in about 19% of patients, where they reported worsening pain and swelling. Then there was psychological harm. Almost 7% suffered from psychological distress due to the delay. So imagine they're waiting to get treatment, their symptoms are getting worse. Sometimes it's a major problem, others it's a minor problem, but things are just getting worse. And then of course there was quality of life. The delay in treatment significantly impacted patients' quality of life, many reporting a decline in their physical and mental health. So at the end of the day, what does all this mean? Well, this study highlights the importance of timely intervention for varicose veins. Delaying treatment can lead to progression of the disease and an increased risk of complications. So as we navigate this post-pandemic world, it's crucial to address the backlog of elective procedures and ensure that patients receive the care that they need. This study serves as a reminder that conditions like varicose veins, though often considered low priority, can have serious consequences if not treated promptly. Okay, so listen, if you have heaviness, aching, swelling, throbbing, itching of your legs, or you notice varicose veins or spider veins, give us a call, or just go to our website at millervein.com. And if you have any questions, please put them in the comments below, and we'll see you in the next video.